In this video, I'm doing a video reaction. I haven't done one of these in a minute. This time, I'm reviewing this video by Dr. Yun, where he talks about the 5 mistakes of penis enlargement. Now, this guy is a famous doctor with over 5.2 million subscribers on YouTube. He typically focuses on things like skincare, surgery, facial surgery, body surgeries, which is super interesting. So go ahead and check him out. But this one was super interesting to me because he talks about penis enlargement, which is like super funny. So I'll go ahead and check it out, give you my thoughts on it, what he gets right and what he gets wrong. So let's go ahead and get started. All right, so this is the guy's channel. His name is Dr. Yun. He has like 5.21 million subscribers, very popular. So he's a holistic plastic surgeon. He does a lot of videos on plastic surgery, celebrity surgeries, things like skincare, but mostly surgery. But some stuff about skincare. So check it out. I'll go ahead and link his channel below. In any case, he put this video, which came up on my feed, which is plastic surgeon reveals 5 penis enlargement mistakes. It sounded funny. So he has this other one, men's private part plastic surgeries will blow your mind away. Maybe I'll do a video reaction on that one. That one sounds interesting. I saw this when it first came out. This was like 10 months ago, so it's been a while.
If you or someone you love has ever thought about making your penis bigger, here are 5 of the biggest mistakes that you can make if you do just that.
Alright, so we'll skip.
On this video, I'm going to give you 5 of the biggest mistakes that you can make if you want to enlarge your penis. And at the end of the video, I'm going to give you a few suggestions on how you can make your penis larger safely.
Safely. Alright, like no surgery is safe at all. But let's go ahead and see. All right, so started with the cutting the suspensory ligament, one of those old school techniques. So from what I've heard from the studies, I've covered this before in other videos. I'll make sure to link that video up here. But essentially, most of the gains that you get are from flaccid length. Your penis basically loses some of the it basically points down afterwards, and you have to absolutely stretch after you get it cut. From the studies that I saw, it doesn't seem to actually increase erect size, but let's go ahead and see what he has to say.
The most widely used surgical procedure to lengthen the penis involves cutting the suspensory ligament that connects the penis to the pubic bone. When this ligament is cut, the penis appears to look longer because there's a bit more of the penis to hang down. This can also cause skin from the abdomen to move towards the penis shaft. Now, this technically doesn't make the penis any longer, it just kind of changes some of the architecture around it. The problem is that cutting the suspensory ligament to the penis can cause the penis to be somewhat...
Yeah, you see it's like basically unstable, which I don't know how big of a problem that is. I've heard guys that have like the inflatable penile implants complain about this problem. But if you watch porn, I think the guys with the gigantic dicks, they also kind of have this problem, right?
Somewhat unstable. And this can be especially dangerous and even cause a major injury to the penis if the person is undergoing sexual activity. Now, cutting the suspensory ligament is often combined with other procedures like liposuctioning of the pubic area just above the penis. And it's important to realize that just because that ligament is cut, it doesn't mean that it stays separated. It can actually heal back together and reshorten the penis at a later time. All
right, next is wasting your money on PRP. Well, I guess we can sort of tell what his thoughts are on PRP. I've never had it done. I've had it done on my face, actually. I love it, actually. I get it done with my Botox every 3 months. I need to make a video on that, on my PRP treatment. I've only done it 2 times so far, but I love it. I haven't seen enough results on the studies on PRP on the penis. I know the P-Long study talks about PRP. I mean, I can see some benefits of it, particularly if you combine it with pumping. I don't know too much about it, to be perfectly honest, but it's not something that I would do. But let's go ahead and see what he thinks about it.
Professionals across the country who are injecting PRP into the penis and claiming that it will make the penis larger. PRP stands for platelet-rich plasma, and you obtain PRP by drawing your blood, spinning it out, and removing the platelets, and then separating those platelets with their growth factors. The idea...
By the way, even for the face, it's fairly expensive. I forgot how much I paid. I think I paid like $10,000 for like, I think 1 or 2 years of treatments. I forget exactly. So it's and that's for the face and the hairline. Anyways, I'm gonna make a video on it. I'll add it to my to-do list. But that's for the face. I don't know what the costs are for the penis. I would imagine it's pretty similar.
The idea is that because you've got a lot of growth factors in this PRP, if you inject it into the penis, it will cause the penis to essentially grow. But unfortunately, the truth is far from it. Injecting PRP does not cause anything to grow except possibly the hair on top of your head. So for this...
That's funny. See, I just talked about it. I don't know. I haven't seen any much results on the hair. I do minoxidil, finasteride, and PRP, and I'm pretty happy with my hair. But I really like the way that it makes my face feel. It gets Anyways, I'll make a video on that.
For this reason, I believe that injecting PRP, although it's not necessarily dangerous to the penis, it really isn't going to do a whole lot of anything.
Yeah. I mean, I agree. I think like maybe if you combine it with other things, such as pumping and traction, like in the P-Long study, I think it'll help. But by itself, I can see it might help. It might help with your erection quality potentially. I've heard of also Botox, which I need to sort of check out, do a video on it. But I would never inject Botox into my penis. I mean, it's it's a muscle paralyzer. I wouldn't want anything like that near my penis. But we'll see what the study has to say about that. But let's keep going.
There's a case report in our scientific literature about a 43-year-old man who placed a titanium penis ring around his penis and his scrotum, and then he had intercourse. Well, after having intercourse, he couldn't get that penis ring off, and it started cutting off blood flow as everything started to swell. Well, he went to...
Oh, yeah. So actually, I saw this in the forums. I believe I saw this in the old Thunder forums where this guy put these, like, I think they have to do with cow, like some sort of cow related ring on his dick, and he couldn't take it off, right? He couldn't take it off. He was kind of an idiot because he didn't go to the doctor for like a day or so, the emergency room. He finally went to the emergency room and they had to use, I think, a saw to cut it. But by that point, his tissue had already become gangrenous or whatever the term is, and they had to cut his dick off. So it's completely horrible. Never use some sort of metallic penis ring. It's a horrible story. You're gonna want to use like the soft cock rings, which you can cut with a scissor, a worst case scenario.
To have it removed, and it was not easy to take that off. The doctor started trying to cut it using pin cutters, and those didn't work. Then they used a jiggly saw, which also didn't work, and eventually went to an electric saw. Well, the saw...
Yeah, so this is a different story. This one seems to have had a happy ending. This guy from Thunder's place, no, he had pictures of his cutoff dick. It was fucking horrible.
It seemed to work, but the area got so hot that the patient started getting first-degree burn wounds around his penis and his scrotum. Eventually, they contacted maintenance, and they brought a pair of industrial-strength bolt cutters, and these bolt cutters were eventually able to break this ring in 2 different places.
I mean, but this, I guess it's a mistake, right? The mistake is sort of clamping or using sort of metallic ring. I get it. I guess I agree with that. These are super high level. These are normie videos, right? Like, yeah, I guess they're mistakes, but there's not a whole lot of context to go around it. But I absolutely agree, right? The right way to do it is to use those soft girth bands. Anyway, so keep going.
Places and remove it. So if you're thinking about using a penis ring to make your penis bigger, definitely don't use one that will not expand, like one made of titanium. You have a risk of strangulation of your penis and even of your ballsack.
That was a funny clip. All right, filler. So this is something that I would absolutely consider. Would probably only consider like HA filler. I think the best possible resource is if you get something like inflatable penile implant, right, which you can actually lose girth from it. You can actually lose length if you don't go to a good doctor. And you can lose girth on it because they only go up to a certain length. You could potentially use like a vacuum pump. Over time, it'll make it bigger, but that's arguable how safe that is, especially with an implant. I'm not talking about implants to make it bigger. This is for guys that have ED, and this is like really, really bad ED. They get these inflatable penile implants, and then they get like hydrolytic or PMMA or even fat graft into their penis as filler. Based on the studies, again, I have a video on that. The safer ones are like the hyaluronic acid filler, which dissolves. Although the new research nowadays on facial hyaluronic acid filler is that it doesn't actually fully dissolve, it just migrates, which is why the celebrities get those like fucking Giga Chad looking faces. They look horrible, like that chick Chrissy Teigen, right, who looks to me like the fucking Predator. She's fucking hideous to me. She has this bloated ass looking face because the filler doesn't go away. But this actually might be a good thing when you're injected into the penis. So in any case, let's see what he has to say about filler.
One of the most common ways to make a penis larger is to inject a hyaluronic acid filler into it. Technically, this is off-label as the FDA does not approve these injections for this use. Now, hyaluronic acid fillers last about 6 to 12 months, and it can be injected throughout the entire penis, typically through the shaft, to make the penis wider. Now, it does not make it longer, but it can make it wider. But there are doctors and nurses throughout the country who are also injecting other substances into the penis that are much more dangerous than a hyaluronic acid filler. These substances can include Bellafill and even silicone. And the problem with these permanent injections is that you can get, later on, lumpiness from these treatments. Even if it looks good initially, it's possible you can get these lumps infected, or you can get granulation reaction where these lumps get harder and harder. And you may...
Yeah, I've actually seen this in porn, right? Like these guys that have injected this filler. It looks super lumpy. It looks fucking hideous. I would never get any sort of that filler. Hyaluronic is great because, it's non-permanent. I heard that guys can massage it, and if you massage it, it kind of evens out. But the problem with the reason that this happens, this lumpiness happens, is because the penis retracts, right? You're not erect all the time, and so because of this, changes in the penile size after you get the filler, is what causes the lumpiness. But if you have a penile implant, you can actually keep your dick safely inflated for many hours, which can actually generate an evenness. So if you see some of the results on like Frank Talk, guys with inflatable penile implants and filler, it looks great. It looks great. So I think it's absolutely viable. If you have really bad ED and you need to get like an inflatable implant, you can always get some sort of filler on top of it. I've seen guys with PMMA, with fat grafts, and even that looks really good. I think it's incredibly dangerous, but again, hyaluronic acid is super expensive and not permanent. So, you kind of gotta give or take. I would probably, I'm lucky enough to have some sort of disposable income where I would just get the hyaluronic acid. But I've heard of guys that go to TJ and get like the PMMA stuff. It honestly looks good. I'm not gonna lie, but I don't know, like sensation. They like it on you. They tend to like it. I've seen surgeries where they're, fixing penile implants with people that have like fat grafts, and I mean, the inside looks gross, but like it looks perfectly fine. So just something to think about.
You may not see or feel it as much when you're erect, but when you are flaccid, it can cause your penis to look quite lumpy and misshapen.
Who gives a shit whether your penis looks flaccid? I mean, I guess if you have like a girlfriend, or something like that, but I don't.
I kind of think about the Thing from Fantastic Four, what his penis must look like, and that's what your penis could look like if you have too much permanent
That's funny.
fillers injected into it, being performed to make the penis larger as well.
Thinking extensive surgery will make your penis longer. Yeah, absolutely. There's no, unless you have peyronie's, there is no surgery that will make your penis longer. Erect, full stop. Okay. So if you get something like the penuma, that will give you girth. It will give you flaccid length, but it will never be any longer than you already have with erect length. If you get the only surgery, if you have peyronie's, is called the sliding technique, where they literally cut it like a chicken, like they skin it, right? They make these incisions. Depends on the newer ones. They make like little, it looks like a net, right? There's like this crisscross. And you have to absolutely get a penile implant because you will lose all ability to get a natural erection. So you have to get an inflatable penile implant, and then they'll stretch it out, and then you have to keep the implant inflated for many months. And they usually put a graft on it so that because you're gonna have all these holes, right, or a big hole on the old sliding technique, and but it cannot be longer than your neurovascular bundle in your urethra. So guys with Peyronie's, they had contracted, right? So they already have stretchiness of the neurovascular bundle and stretchiness of the urethra, so they re-stretch it back to their original length, right? Because of the scar tissue. But guys with normal, healthy penises, they don't have that, right? The neurovascular bundle and the urethra is already stretched out. So they're like, even if you do get like something like the sliding technique, it'll never get length. So the only safe, scientifically proven way of increasing erect length is traction. There's many studies on it, but no, surgery will never do this unless you lost length with Peyronie's. But let's see what the doctor here has to say.
Well, some doctors are injecting fat into the penis, which is safer than some of these other permanent fillers, but even that can cause a penis to look lumpy afterwards. But a much more invasive procedure that I would really caution you against is slicing open the penis and putting in different types of implants. Some doctors are inserting alloderm into the penis, which is essentially cadaver skin. Yes, they are putting cadaver skin into penises to make them wider. Now, these treatments do not necessarily make the penis any longer, but they can make the penis wider.
Why, this is like the penuma or the implant, which is fucking horrible. I should do a video reaction on Dr. Francois Eid, who has a video of him removing one of this penuma implants. It looks fucking horrible. It leaves you a scar. You lose sensation. You get a marginal amount of girth, which I think you're better off just with either filler or just pumping. It's way better. I think these are things that are for people that are like ignorant, that are impatient, that don't want to put in the work, but you can get much better results with pumping or even filler than something like the penuma.
Or basically increase the girth. The problem with these procedures is that they are invasive surgery. You can get all kinds of complications, from bleeding to infection to permanent numbness. Yes, you can get a numb penis and possibly even a scrotum after these invasive procedures. So yes, if somebody calls you numbnuts afterwards, that term can actually be very accurate. So if I'm not recommending these treatments, then what can you do to make your penis larger? Well, the first thing that you...
All right. Let's see. This is the key part. Let's see what he talks about, right? Like I mentioned, traction, scientifically proven, many studies, P-long study. which granted hasn't been replicated. But there's a lot of other study there's other studies that back up that traction works. Pumping, less studies on it, but I think that's a viable option. You go down the list, you can do clamping, right? But these are really the only things that you can really do to increase length. But let's see what he talks about.
You can do is you can shave your man bush by decreasing the amount of hair that is around.
I mean, I guess that's like, of course, you should always shave. I think like it looks fucking horrible. I have Manscaped, which I use all the time because I don't want my girlfriend having, like going down on me and it's all some hairy ass shit. Like I want it to look nice, and it does make it look bigger. It's a visual thing,
Around your penis and your penile shaft, it may make your penis look larger. If you doubt me, then just try it. Look in the mirror and see your before and after, and I bet you're gonna see that your penis looks bigger afterward.
Yeah, if you don't fucking trim down there, you're fucking disgusting.
The second way to make your penis look larger is to reduce your suprapubic fat. And
yeah, this is a big one. Actually, I was in one of my friend's streams and somebody dick flashed them, and it was this obese guy with a buried penis. Like you couldn't even see his fucking penis. There's nothing to flash. And so yeah, this like the number one things. Obviously, I think these are like just basic things. He's right? But let's see if he talks about traction.
this is the fatty area that is just above your penile shaft. Now, there are many ways to reduce the amount of fat that is in that area, starting with weight loss and progressing to liposuction. Liposuction can be a very safe way to reduce the excess fullness in that area and make your penis appear to be longer. Another way to improve your penile function is to improve your cardiovascular health. Now, we've been talking about the length of the penis and not so much about ED or erectile dysfunction, but one of the first signs.
Yeah, I mean, this is something you obviously gotta do, right? Like, you don't even waste your time with surgery. Don't even waste your time with other PE techniques unless you trim, unless you lose weight, unless you do cardio regularly and you have a good health, and then take supplements. If you don't have HSV1, you can take L-citrulline, arginine, or take Cialis, daily Cialis, right? These are very helpful.
Signs of poor cardiovascular.
Don't be a fat ass. Don't be a lazy ass, right? Even me, I'm losing weight. I've lost like 10 pounds in the last couple weeks. So yeah, you can do it.
Health. Atherosclerosis is erectile dysfunction. And the reason why is that the penile vessels are some of these smaller vessels of the body. And if they get clogged up with plaque and you're unable to essentially get an erection, then that could be one of the earliest signs that you have significant cardiovascular disease. So improving your health by exercising regularly, by eating a healthy diet filled with colorful fruits and vegetables, and by seeing your doctor and getting tested is so important and can even help you with your penile function. So these are 5 big penis mistakes, but what are 5 of the worst causes?
All right, there you go. So let's do our final thoughts. And there you go. I think it was kind of a funny video. I think the mistakes were spot on, right? The 5 mistakes. There was not a lot of context around it. Hopefully my reaction gave you a whole lot more context as to what kind of mistakes he was talking about. I think PRP is one where like the jury's still out. I if you have the money, I would do it, but I'm already doing it in my face. And if I had even more money, I would definitely do it down there. As for like what can we actually do? Absolutely. I mean, this guy is a normie. He does content for normie audiences, right? Absolutely, you should be doing exercise. Absolutely, you should have trim down there. But, one thing that he didn't mention was neither pumping or traction. I think for good reason, right? He doesn't want to like encourage people to go and willy-nilly do these things and end up injuring themselves, which is why you have like more niche channels like myself and stuff like that. So in any case, I thought that was super entertaining. I thought it was overall a good video. So go ahead and check out the channel if you like. Go ahead and subscribe to my channel first, then go ahead and do that. And if you like this video, make sure to check out these other videos which may be relevant to you, and I'll see you next time. Peace.